My name is Lindsay Cole, and I got diagnosed with breast cancer in July 2013.
My name's Joanna Bott, and I was diagnosed aged 26 with breast cancer in February 2011.
I am Emma Fortescue, and I discovered my lump at the beginning of the summer holidays in 2012.
You see life in a different way, your priorities change. I know a lot of people, I've met a lot of people that have been through treatment, that are going through treatment, and yeah, it definitely changes you. Life's never the same again.
Everybody knows somebody that has had cancer. Everybody knows somebody that has come through our service. Whether it's direct or indirect, you will have something to do with our breast service.
Presently, when a patient has a diagnosis of breast cancer, we see them in medical surgical outpatients. The clinical rooms that they're diagnosed in are quite clinical. Our office is doubled up as a lymphedema clinic room.
I think at the moment it's not a good situation, and we provide as much support as we can. And often with a diagnosis of breast cancer, you are understandably very upset, and so we then have ladies in tears effectively walking through a waiting room full of other people.
There's a room where they fit prostheses and you can choose a swimsuit and everything. There isn't any room. There isn't a mirror in there. They do try and make it as nice as possible, but it's tiny.
When they're going to a clinic, they have to undress, they have to dress again to go off to find radiology. They've got to find it. If we could have it all in one place, we hope that some of that anxiety will be lessened.
The staff and everything are fantastic up there, but I think to have a separate unit somewhere where everybody can go to, breast cancer can be quite isolating, especially when you're so young and there's not many other people your age going through it. So I think to have a dedicated unit, I think would be fantastic.
We visualise with our new unit that we will be able to walk patients through, so they're coming into a room that is airy, windows, art care in there, at a time when they're feeling so anxious.
You would still get the same treatment. You would just get it in an environment where you know you're all the people with the same problem, rather than wondering if they got breast cancer like you or is it something different.
We can have here in Salisbury breast care being the NHS at its best, but actually if we can provide an environment here at Salisbury, we're going to make that service even better, and a service that local women and men deserve.
That's what this new unit will provide. It will provide a better environment for these ladies, and it will provide us the ability to run 3 one-stop clinics a week, so we're getting all the answers in one session, and that's really what I want.
I know the month that I was diagnosed, so were 33 other ladies, which is huge. And I know they said that was unusual, but I have a horrible feeling it's not going to be unusual. So to have a unit would just be amazing.
Because of the increased referrals, different ways, new ways of working, trying to do more biopsies in order to avoid surgery, all that increases the workload, and at the moment, our service at this moment can't continue to cope with that. So we do need that unit in order to be able to carry on delivering the service that we've been very proud of.
Everybody being located in the same place I think takes away a lot of the fear and worry about communication and does everybody know what's going on. They'll probably be able to get through more patients in a day and be able to give us, I think, a more personalised, holistic service.
Well, I've just qualified as a veterinary nurse, so I'm planning on obviously doing that for the time being. We've got a few holidays coming up, so I'm into my climbing, so we're going off to do a few climbing trips. I don't really think too far into the future. I don't make too many plans into the future, so short term is sort of, I have short term goals really.